been in this pandemic situation. There's been a lot of uncertainty. We have people on, I won't say both sides of the issue, all sides of the issue. You know, people who say it's a hoax, people say it's no worse than the flu, people say, I don't care how bad it is, I'm going to do what I want to do. Why don't you tell me from your experience since the beginning of this, how you and your responsibilities have progressed and where we are now? I mean, what's the real situation in your eyes right now, where we are right now?
Sure. Thank you, Mayor Martin. You know, initially when this started, we did not expect us to be in the situation we are now, almost 9 months later. And obviously, we didn't think that it would grow to the scale that it actually has. I can tell you that, you know, most recently, just last week was the highest all-time new cases we've seen in the pandemic. Over 1,000 new cases just in the last week alone. 187 of those cases were here in Paso Robles, and if we include all the North County in general, that's 360 new cases. Today, we're at 59 deaths, and 14 of those deaths occurred just last week. So 25% of the deaths in San Luis Obispo County occurred last week. And I think when we, you know, obviously I'm hearing both sides as well. Some not necessarily believing all of the numbers. And, you know, I'll be the first to admit, the numbers aren't 100% accurate, and it's hard to find numbers that are 100% accurate anymore. But I think what we can say is, based on us here in emergency services, we are seeing the impacts of COVID-19. Last week, over 14% of our calls were for COVID patients. We have a number of firefighters that have been in isolation or quarantine. And probably the biggest impact is, you know, I hear that people say, well, it only affects the elderly. And you know what, it is affecting the elderly a lot more than it is the younger people. But what's happening is there's a couple of care facilities I know for a fact that over 90% of their residents are infected. And yes, they're all elderly. But where we're seeing the biggest problem is 65% of the staff are infected. So those are the younger people. Even though they're not as sick, they're still exposing the elderly. And I know there's one facility in the South County that was down to just a couple of nurses helping out in the facility because they had no staff left. So it's starting to really impact our county. And I just wanted the community to be aware of those impacts.
So since the beginning, our area, and I realize it's not the city proper, it's the zip code 93446, but our area has led the entire county in the number of infections. Number one, do you have any idea why that is? And number two, even though the number of total infections is large now, is the rate of infection in the North County changing?
I would say yes to both. Obviously, we are seeing the rates increase specifically in the Paso Robles region. And I'm sorry, I don't have an answer why they don't break it down any more than the Paso Robles region. It's becoming even more difficult than it was in the past because of all the new cases. It's hard for the county contact tracers to keep up with that. So I'm sure there's more cases that we're unaware of, and I do know there's a backlog. But yes, we are seeing the cases countywide increase, but still Paso Robles continues to be the leader, and I don't have an answer either on why we continue to be the leader in that.
So as we're looking forward to next year now, most of us are hopeful about the vaccine. I won't comment on people that don't like vaccinations. That's a whole other story. But between now and the time that the vaccine is made available to the general public, is there really any way that we can mitigate this virus in our area right now? Or is this just something we're going to have to wade through and wait till we get inoculated?
Yeah, I would say just based on the current trends we're seeing in our communities, and you know, some people not adhering to some of the protocols, you know, wash your hands, wear a face covering, and avoid crowded environments, that unless we change the way we go about our business day to day, we're not going to see a significant change. Additionally, yes, the vaccine will help out. And I'm sure all of you, we hear more about the people that receive the vaccine that have adverse reactions than those that don't. And of course, not every vaccine is 100% without problems, and we're going to see that. But, we'll be the first in line. We're starting today. The Pfizer vaccine became available to all our first responders. So we have our staff out getting the vaccination today. And I would encourage the community to do that as well. There's not enough vaccine to go around yet. And just the healthcare workers in this county alone is over 17,000. And we just only got 1,900 doses. So we have a long ways to go just to inoculate our critical healthcare workers. And then I don't anticipate any vaccinations till early summer for the community. So we just need to be prepared, and we need to take additional actions prior to getting that vaccine. And those are the steps I just mentioned earlier.
Now, obviously, all the way through this pandemic, we've all been changing our lives. We've been changing the way we make a living. Everything's changed. I mean, I can't think of a single thing that I used to do routinely that I don't think about twice now before I do in a different way. And quite frankly, after this long period of time, particularly for our businesses, the ends are getting kind of frayed on this road. I mean, people have spent down their savings, they've spent down their loans, and we're getting to a point now, even as we round the corner, hopefully, on this pandemic, that people are really concerned their livelihood is not going to make it through the next 6 months. Now, in the city, obviously, we've tried to balance that out. We've tried to comply with all the state regulations to the capacity and extent that we can. But at the same time, just from the point of view of community health, not just business health, but community health, it seems like we have to be able to be just a little bit flexible in how we make that work. And I realize personally that probably increases the likelihood of sickness to a certain extent. But how do you feel about that balance? How do you feel about how that needs to be handled?
It is a fine balance, and I'm not going to sit here and say that I know how these businesses are feeling. I don't own a business, but I do have friends that do, and I'm constantly hearing how they're struggling, and I get it. And I'm sure you and I are just as tired of the restrictions and the precautions that we have to take, but we have to continue to do so. I will say, based on the current trends, that I don't expect the governor's stay-at-home orders to be lifted till late February, early March, if we continue down this trend. So we talk about that balance between business and our personal lives. I would just say, if we continue to take some mitigation actions, in our day-to-day lives, then hopefully we can get back to that purple tier sooner. But the current trend we're heading down right now, I'm not seeing that occurring, like I said, till at least March. So it's an unfortunate situation, and it's frustrating to see our businesses suffering and everyone's day-to-day lives being impacted. We're seeing domestic violence go up. Obviously, our exposure rates in the fire department are going up. There's no win here, but I think collectively we just all need to work together and get through this.
So I'll incrementally help address this situation by taking personal responsibility for our own health and for the health of the people in the 6 to 20 foot area around us. And that may seem like a small thing. One person doing that, how is that going to affect this? And the answer to that is one person doing it won't. If 30,000 of us do that, it will.
Yes. And holiday seasons are right around the corner. And right now we're just seeing what the Thanksgiving season has showed us in the trends. And I know people miss their families. I haven't seen my in-laws in quite some time. They live outside the area, but I would say, if you gather with your family, if you decide to do that, then just practice social distancing. Don't have a lot of people there. And I think there's precautions that you can take. We just don't want to see the same numbers that we saw during the Thanksgiving holiday.
Right. So what have we missed here, Mr. Stornetta? What else would you like to add?
I can't express enough how thankful I am to the community and helping all of us get through this. Obviously, Mayor Martin and myself, it's become our full-time job, helping out with the COVID pandemic and making sure the city stays positive and moving forward. And I think it's just I just like to reiterate that, I want to wish everyone a very happy, health, and safely holiday season. And let's continue to get through this together. Please take some precautions if you're out there with extended family, And please don't hesitate to reach out to either one of us. If you have any questions, if you're questioning the numbers, please call us. I'd be happy to explain them, because obviously both you and I work very closely with the county, and maybe there's something we can provide you that you're unaware of.
I think it's important that people understand, again, how they get a hold of us. They can get the most recent stats, countywide and statewide for that matter, if they go to readyslo.org. That's updated regularly. That's the best information we have regarding the spread of the virus, and that'll give you a lot of good information there. There's a lot of information also on the city's website at prcity.com. If someone wants to contact the fire department, emergency services directly, how would you advise them?
You know what? They're welcome to call my personal office line, and that's 805-227-7562.
Very good. Well, thank you for taking the time, and thank you for all the work you and all of our emergency services personnel do, especially during this time of pandemic. Again, happy holidays to you, and there is a light at the end of the tunnel. It's our job now to get out of the tunnel as quickly as possible.
Sure.
Thanks again. Have a great day.
Thank you, Mayor Martin.
Okay, that's good. I'll edit this down and get it back to you.
Okay, thank you, sir. Happy holidays if I don't talk to you beforehand.
Thank you. Same to you. Take care.
You too.